Hello students, today I will be talking to you about fevers, the types of fevers, their symptoms and how to manage the diet during fevers. Fever, it is an elevation of temperature above the normal and results from an imbalance between the heat produced in the body and the heat eliminated from the body. Now, in normal adults, the average oral temperature is 37 degrees centigrade, or in Fahrenheit, as we all know, it is 98.6. Fever may occur in response to infection, inflammation or unknown causes. Fever of an unknown origin, which we define it as FUO, is defined as a febrile illness which lasts for more than 3 weeks with the temperature of the body exceeding 38.3 degrees centigrade on several occasions and which is lacking a definitive diagnosis after 1 week of evaluation in the hospital. The type of fevers include drug associated fevers, transfusion associated fevers, infections. Now, common fevers are almost always classified broadly into 3 elementary categories, which can be caused by bacteria, viral fevers and parasitic fevers. So, I will just give you examples of various types of fevers which we come across in our daily life: influenza, malaria, typhoid fever, measles, chickenpox, rheumatic fever, meningitis, dengue fever, chikungunya and viral hepatitis. Now, fevers have different durations. They can also be classified based on the duration for which they are present in the patient. Now, we classify them as short duration fevers such as cold, tonsillitis, influenza, typhoid fever, chickenpox, etc. Now, intermittent fever, fever which comes and goes periodically. The example for such fever is malaria. We have long lasting fevers which can last from a few days to a few months, and example for this is tuberculosis and typhoid. A fever might be caused by endogenous factors, which is antigen and antibody reaction. It can be due to cancers or malignancy and rejection of grafts. Exogenous factors include that is infectious agents like bacteria, parasites, virus, fungi, etc. Now, certain inflammatory conditions such as rheumatoid arthritis, which causes inflammation of the lining of the joints, certain medications such as antibiotics and drugs which are used to treat high blood pressure or seizures can also cause fevers. Certain immunizations such as diphtheria, tetanus and what we call acellular pertussis or whooping cough, or immunization against pneumococcal vaccines, they also cause fevers. Fevers can also be caused by heat exhaustion during summer, extreme sunburn. Now, let us see development of fever due to exogenous agent, the steps which occur in our body whenever we get an infection either due to bacteria or virus or any other infective agent. First, this leads to activation of phagocytes in the bone marrow, which leads to a release of pyrogen, which is nothing but a fever inducing hormone. Now, this leads to synthesis of prostaglandins. Prostaglandins are non-glandular hormones which are secreted in the blood for a specific response. Now, this leads to a thermoregulatory center in the anterior hypothalamus, increases the body temperature. Now, what happens to our metabolism during fevers? You should understand that the metabolic changes which occur in fevers are related to nutrition. The most important changes which may affect the nutrition are increased metabolic rate, almost as much as 7% for every 1 single degree Fahrenheit rise in the body temperature. Decreased glycogen stores, because during fevers the body utilizes the glucose as a source of energy. Then accelerated loss of body water, because the body loses water in the form of perspiration and the excretion of body waste. Increased excretion of sodium chloride and potassium. Decreased motility and reduced absorption of nutrients. So, during fevers generally the person's ability to absorb nutrients is reduced. Increased protein metabolism, which is especially excessive in typhoid fever, malaria and others. The additional end products of protein metabolism, which are excreted as urea, place a heavy burden upon kidneys. So, basically in fevers there is an increase in the energy needs of the body, as well as there is more utilization of energy from glucose. There is a depletion of glycogen stores as well as protein metabolism, leading to more release of urea as an end product, putting a burden on the kidney. Now, let us see the symptoms of fever. There is of course the first and foremost common symptom is a rise in the temperature of the body heat. Second, perspiration or shivering, restlessness and agitated temper, pain and soreness all over the body, but some limbs may be extra painful and sore, and of course there is excessive thirst. There is also loss of appetite. Now, let us see what are the general dietary considerations that are needed to be taken care of during fevers. The diet in fever depends on, first and foremost, the nature of the fever and the severity of the pathologic conditions. Second important point, length of convalescence. The diet that we give during fevers should be able to meet the body's need for the following nutrients. First and foremost, energy needs. The caloric requirement may be increased as much as 50% if the temperature is high and the tissue destruction is great. It is very clear that the amount of energy that we need to provide during fevers is more than normal. Restlessness also increases the caloric requirement. Initially, the patient may be able to have an intake of not more than 600 to 1200 kilocalories daily, but this should be increased as rapidly as possible. Now, this low calorie intake is, as you know, related to one of the symptoms, which is lack of appetite and restlessness. Protein, about 100 grams of protein or more is prescribed for the adult when the fever is prolonged. For example, when in tuberculosis etc., a person needs a high protein diet. This will be efficiently utilized when the calorie intake is liberal. So, always remember, whenever we increase the protein content, there should be sufficient energy also in the form of calories from the diet, basically because if the body is not getting enough energy from carbohydrate, then what does the body do? It utilizes the protein as a source of energy. Therefore, to save protein for its main purpose in the body, we need to provide also sufficient energy from other sources. High protein beverages may be used as a supplement to the regular meals. Milk can be given in large quantities along with additional supplements or any other protein supplement which increases the protein content in the diet. Now, let us look at carbohydrates. Glycogen stores are lost during fever. Therefore, we need to replenish by a liberal intake of carbohydrates. Glucose, a simple sugar which is less sweet and readily absorbed into the bloodstream, is preferred. Why? Because it is easily absorbed. Therefore, remember, the diet during fevers should provide carbohydrates rather than complex which need a longer time for digestion. Let us see the fat. The energy intake may be rapidly increased through the judicious use of fats, that is about 35 grams of fat may be given, but at the same time the most important thing to be remembered here is one must avoid giving fried foods because they interfere with the digestive capacity. Now, minerals, a sufficient intake of sodium chloride is accomplished by the use of soups and liberal sprinkling of salt on the food. Fruit juices, a relatively good source of potassium, also should be included. A person will be losing lot of fluids. Along with the fluids, electrolytes such as sodium chloride and potassium will be lost. So, therefore, the good sources of sodium chloride and potassium in our daily diet coming from vegetables and fruits, and these vegetables should be given in an easy to digest form, that is soups, and plenty of fruits and fruit juices should be given in order to replenish the fluid lost. Vitamins. Fever apparently increases the requirement for vitamin A and ascorbic acid and B complex vitamins are needed at increased levels which are proportionate to increase in the calories. The calorie intake and vitamin B complex intake is much related. If you are giving a high energy diet, always remember to give more amount of B complex vitamins, and of course vitamin A and vitamin C in the form of ascorbic acid because they are antioxidants and they help the body to recover much faster. Fluid. The fluid intake may be liberal to compensate for the losses from the skin in the form of perspiration and to permit adequate volume of urine for excreting the waste. The daily need for fluid is anywhere between 2500 to 5000 ml, which can be given in the form of soups, fruit juices and water. Now, let us look at how well the food is digested during fevers, which we categorize under ease of digestion. Bland, readily digestible food should be used. Fever interferes with the digestive capacity of the individual. This food may be soft or of regular consistency. Fluid diets can be used initially. If it is continued, there are certain disadvantages, and let us have a look at why. Most fluid diets occupy bulk out of proportion to the calories and nutrient values, so that reinforcement with solids is essential. If you are giving fluid diet, it fills the stomach, but it does not provide the necessary amount of energy and all other nutrients. A liquid diet sometimes increases abdominal distension to the point of discomfort, whereas solids may be better tolerated. That is, whenever we give liquids, they cause discomfort to the patient and a lot of pain will be there, whereas if you give a soft solid diet, it is much better tolerated. Third reason, many patients experience less anorexia, nausea and vomiting when they are taking solid foods. That is, whenever a person is having fever and you try to force a liquid diet, they might have a lack of appetite and they might vomit. So, in order to prevent that, give small solid feeds at frequent intervals. Now, intervals of feeding. Small quantities of food at intervals of 2 to 3 hours will ensure adequate nutrition without overtaxing the digestive system at any time. With improvement, many patients consume more food if given 3 meals and bedtime feeding. The duration of many fevers has been shortened by antibiotic and drug therapy, and nutritional needs are usually met without difficulty. But during an acute fever, patient's appetite is often very poor and small feedings of soft or liquid foods which are as desired by the patient should be offered at frequent intervals. Sufficient intake of fluids and salt is essential, and if the illness is there for more than few days, high protein and high calorie food should be emphasized. Now, we will have a look at the specific fevers and how they should be treated. Diet in fevers of short duration. An example is typhoid fever. Typhoid is an infectious disease with an acute fever of short duration and occurs only in humans. Now, this is caused by Salmonella typhi. Feces and urine of the patients or carriers of the disease are the source of infection. Houseflies also help in the transfer of the bacteria from feces to food. Typhoid bacilli do not multiply in water, but they may survive for up to 7 days. They may survive in ice and ice creams for over a month. So, we need to be careful whenever consume any ice from outside your home. Typhoid bacilli, they grow rapidly in milk without altering its taste or appearance in any way. Now, vegetables which are grown in sewage forms and washed in contaminated water are a positive health hazard. Incubation period is usually between 10 to 14 days, but it may be as short as 3 days or as long as 3 weeks depending upon the number of bacilli ingested. What are the symptoms? The disease is characterized by continued high inflammation of the intestine, formation of intestinal ulcers, hemorrhage and enlargement of the spleen, and Peyer's patches of lymphatic tissue situated in the small intestine are the seat of infection in typhoid fever. The patient may complain of diarrhea or constipation and severe stomach pain. Abdominal absorption of nutrients is decreased and the patient may feel symptom of headache and anorexia. Now, what are the principles of the diet for treating a typhoid patient? A high calorie, high protein, high carbohydrate, high fluid, low fat, low fiber and bland diet is recommended for typhoid patients. Now, and what are the suggestions? The general principles of dietary treatment which we discussed for fevers are also followed for typhoid. At first, clear fluid diet is given, followed by full liquid and soft diet, and liquid diets may not meet high calorie and high protein requirements, but as the patient improves, a soft diet can be given. Liquid diets are helpful in meeting water and electrolyte requirements. Because of intestinal inflammation, fiber and spices must be eliminated in the diet. Refined cereals, breads, eggs, boiled potato and simple desserts like custards and porridges can be given. Now, next we will talk about another short duration fever, that is influenza. Influenza is an acute infection of short duration. It spreads from person to person by contact inhalation of the virus. A sneeze or a cough from an infected individual produces many droplets containing the virus, and these may be inhaled by the people nearby. Symptoms of this fever include the incubation period is about 2 days with a range of 1 to 7 days. Onset is usually sudden and the symptoms include headache, lassitude, myalgia, shivering and fever. The illness is associated with fever and it lasts for about 5 days. Bronchitis and pneumonia are the most important and frequent complications of influenza. Malaria is classified under intermittent fevers. Malaria is transmitted from human to human by the bite of the infected female Anopheles mosquito. Induced malaria occurs due to congenital transmission or blood transfusion. Symptoms include over 4 to 6 hours shaking, chills, fever 41 degrees centigrade or higher and the sweating stage, fatigue, headache, dizziness, anorexia and nausea, There will be slight diarrhea, vomiting, abdominal cramps, backache and dry cough. When acute symptoms have continued for 4 or more days, splenomegaly, that is enlargement of the spleen, usually appears. The diet is fruit juices with glucose, coconut water, milk if there is no diarrhea, custards, thin dal, boiled egg, baked fish, cottage cheese, cereals, vegetable juices, bread, boiled potato and porridges can be given. But the foods that need to be avoided are butter, ghee, chilies and spices, fried foods and cream soups. Now, chronic fever is tuberculosis. So, let us see what are the symptoms, what causes tuberculosis and how to manage its diet. Very important, because tuberculosis is a common disease and it is occurring in most of the population. Tuberculosis is an infection disease caused by the bacillus Mycobacterium tuberculosis. This affects the lungs but may also be localized in other organs such as the lymph nodes or kidneys. Symptoms include pulmonary tuberculosis accompanied by wasting of tissues, exhaustion, cough and fever. In the acute phase, high fever and increased circulation and respiration are present. In the chronic phase, it is accompanied by low grade fever. That means low grade fever for a long period of time. Because of the prolonged illness, considerable wasting of tissues may be present, that is, a person loses weight rapidly. As the disease progresses, the patient begins to exhibit other symptoms such as loss of appetite, pain in the chest, fatigue, weight loss, sweat and a persistent worsening cough. If the blood vessel is eroded in the lungs, the sputum may be streamed in blood. Death ultimately results when sufficient damage has occurred in the lungs and other vital organs. Modification of nutrients includes energy. Since the metabolic rate is not as high as in other fevers, weight gain can be maintained with 2500 to 3000 kilocalories per day, and it can be like 45 to 50 kilocalories per kg of ideal body weight for adults, and for children 90 kilocalories per kg of ideal body weight. It is not desirable to gain more than 10% of ideal weight for the body frame. Protein intake in excess of normal requirement or a high protein diet is necessary in tuberculosis, since the serum albumin levels in cases of advanced and long standing tuberculosis may be low. Therefore, 80 to 120 grams per day helps in regenerating the serum albumin levels which are low. Minerals. Now, the drug used to treat tuberculosis interferes with vitamin D metabolism. Therefore, calcium should be provided liberally, since it is needed to promote healing of the tuberculosis lesions. At least 1 liter of milk should be given daily. Now, certain guidelines are there. Food should be bland in flavor, non-stimulating and should be easy to digest. Since the patient has poor appetite, it should be appetizing, and initially small quantities of fluid diet should be given. Good quality protein, then avoid fatty foods, spicy foods, and 2 to 3 servings of fruits, and as the patient improves, there should be better improvement in the diet which is given, and the patient should come back to ideal body weight. Rest, fresh air and good nutrition are the key elements for recovery from tuberculosis. So, students, I hope that in the lesson that I have covered just now, you have understood very clearly what are the different type of fevers, their symptoms and how to manage the diet of a patient suffering with fever.